I'm Dr. Scott Little. Would you know for certain if you or a friend or a loved one or just someone in your presence might be having a heart attack? Do you know the signs and symptoms? Well, I think it's worthy of review. Certainly, we associate people that are having severe chest pains, maybe report an elephant feeling on their chest, or having pain or discomfort and radiating and shooting down their left arm. We associate that with signs and symptoms of a heart attack. But that's not always the case, and you need to know that women may be different or have different signs and symptoms than men. So typically the number one sign or symptom of a heart attack is indeed chest pain. May be reported as a tightness or a pressure, may feel, like I said, as an elephant sitting on one's chest, or a pinching or a burning. But oftentimes women don't experience chest pain. They more often might experience stomach problems, nausea, vomiting, indigestion, heartburn, things of that nature. Typically the pain is radiating down the left arm, but especially in women, it may be radiating down into the right arm. So don't get locked into an idea that heart attacks are associated with left-sided symptoms. A person might just feel dizzy or lightheaded. Now, there are many causes of feeling dizzy and lightheaded. Many people have adrenal fatigue, and if they stand up rapidly, their blood pressure may drop and they may feel dizzy or lightheaded. People may be dehydrated and feel dizzy or lightheaded. So it's not always that one is having a heart attack, but if that dizziness and lightheadedness is accompanied by chest pain, then you might need to think in terms of a heart attack and call 911 immediately. Throat or jaw pain. Now this could be related to any number of things. Cervical misalignment will oftentimes result in TMJ issues, and jaw pain or throat pain may be associated with a cold or something like that. What we're talking about is different. If the pain starts in the chest and then radiates up into the neck or into the throat or into the jaw, then that's when you want to think 911 and that it's something different than just neck pain, jaw pain, a muscular issue, something related with a cold. So that chest pain associated with the pain radiating up into the neck and so forth is what you want to be concerned with. Exhaustion and fatigue. Obviously, that could be a result of someone coming up into our elevation in Colorado, but it may be related to a heart issue. So if you've got someone with extreme exhaustion, and that's not part of their normal experience, especially in women, unexplained weakness, unexplained fatigue that goes on for days at a time perhaps, that may be a heart issue and perhaps a sign of a heart attack. Snoring. Now, a lot of people snore, but if the snoring is different, if the snoring becomes violent or just very, very aggressive, then that's certainly reason to alert one's doctor. Sweating. A cold sweat for no apparent reason could be a reason to call 911. Swelling in one's legs and ankles and feet, certainly that's a sign of some heart issues, especially if it's an acute situation and not just known in someone who has a weak heart or congested heart failure or something like that. And then an irregular heartbeat. That could be another sign or symptom of a severe heart issue. The number one take-home is that don't get locked into just issues in chest pain or chest tightness and pain radiating down into the left arm. Know that women and men could experience different signs and symptoms, and know as a patient, if you just feel something is not right, this is not just I've been working real hard and my arms are sore or my neck is sore. If you feel like you've got a very significant and different presentation. Don't just rely on your doctor to know that you're having a severe issue. Press the issue. Don't hesitate, because time is of the essence. And please review some of these signs and symptoms on a regular basis, because you never know if you could be at church or out in the woods or in the grocery store or just anywhere, and someone could be having a major heart issue and they need to get medical help ASAP. So I hope this helps, and just review this on a regular basis. I'm Dr. Scott Little.